Welcome to Unit 2, General Health Messages, Outdoor, Ambient, and Household Air Pollution. By the end of this unit, you will describe how to communicate health messages to patients or at community level to minimize exposure to outdoor and household air pollution. Key messages for outdoor air pollution reduction strategies include: reduce exposure to traffic-related air pollution by commuting at less congested times of the day, or, if walking, running, or cycling, to commute on less busy roads. Exercise away from sources of pollution, such as busy traffic. Community waste should be collected and managed effectively instead of burned in open air. In case of wildfires, leave the area if possible. Close windows or use indoor air filters, as well as wear masks where appropriate. And finally, know your number. Where available, consider using the Air Quality Index to know more about the air quality in your context and how you feel. While this might seem obvious, your voice matters and can have a positive impact on behavioral change. An air quality index communicates to the general public current and forecast ambient air quality conditions based on one or more air pollutants. An air quality health index is similar to the air quality index. It communicates the risk to human health based on current and forecasted ambient air quality conditions with health messages to reduce exposure for both general population and high-risk groups. These indexes can communicate health messaging that encourages individuals to reduce personal exposure to ambient air pollution based on current and forecasted pollutant concentration levels. Separate health messages are provided for the general population and the at-risk, susceptible, or vulnerable population who are more sensitive to the adverse health effects of air pollution exposure. If available in their countries, healthcare workers can use air quality indices when counseling patients and individuals about the risks to their health from exposure to air pollution. However, it is important to note that in addition to the AQI, it is crucial to know the actual concentration of the individual pollutants that are included in the AQI summary, as people can be sensitive and react to different pollutant concentrations differently. Much like a weather forecast lets you know if you should pack an umbrella, an air quality forecast lets you know when you may want to change your outdoor activity plans to reduce exposure to air pollution. Many forecasters also provide information about when pollution is expected to be highest during the day, whether there are times when air quality is expected to be better, health advice for the population based on the air pollution levels, and which regions are particularly exposed to high air pollution levels. You will review some examples of air quality health indexes later in this module. Let's now consider key messages to minimize exposure to household air pollution for both individuals and communities. Healthcare workers can advise patients to minimize exposure to household air pollution by changing behaviors, such as reducing the time spent close to the pollution source. This is especially important for susceptible groups such as children. Changing cooking practices, for example, fuel drying, pot lids to conserve heat, choosing food preparation that reduces cooking time, or avoiding smoke. For example, if possible and safe to do so, keeping children in another room away from the source. Minimize concentrations of household air pollution within the home through improved living conditions, such as improved ventilation, for example, chimneys, windows, vents, and so on. Kitchen design and placement of the stove, for example, separate kitchen from the rest of the house wherever possible and reduce family exposure. And minimize emissions from fuel combustion by burning fuels more efficiently or using cleaner fuels, such as LPG and electricity. Reducing household air pollution emissions also involves keeping the home and fuel dry. Damp fuel emits more air pollutants than dry fuel when burned, and dampness in buildings is also associated with an increased risk of adverse respiratory outcomes. Reducing concentrations of emissions through ventilation lowers their accumulation indoors and therefore improves the quality of indoor air. However, venting high concentrations of household air pollution will increase outdoor air pollution. Healthcare workers should prescribe clean household energy solutions for patients and communities. You've now completed Unit 2. In the next unit, we will look at physical activity and air pollution.